She had grade 4 acne. Like there wasn't a centimeter of her skin that wasn't covered with acne, and this was
Understand the difference between purging,
right.
breakout,
Yeah.
and a reaction.
So for that, no creams work. I've had acne, post-acne marks, scarring, hair loss.
Adult acne a condition?
Try and understand the cause of your acne instead of just like buying creams. And
when does he have to come check with the doctor? Accutane. Is it a miracle or overprescribed drug?
I'm not a fan at all. Nobody should do it. Yeah.
What sort of ingredient patient has to see in the product?
And hormonal acne can present on the back as well. You must obviously seek advice only from a qualified dermatologist. So the credentials are.
Hello, Dr. Showrya. Thank you for joining in today. I'm really excited that I'm starting my first podcast with you. I was really looking forward to this.
It's a pleasure, Ritika, and I wish you all the best for your podcast.
Today, we're going to be talking mainly about acne.
Right.
And there's a lot of confusion today.
Yes.
And I see you clearly talking about acne and skin health online,
Yeah.
which is very easy, which is very honest, and which is really interesting to be listening to and to make changes with. So before we dive into all the treatments and routines, I really want to know the person behind the doctor. What made you choose dermatology as a specialization? Was it like, your own relationship with the skin that actually shaped you or played a role into for choosing dermatology?
Okay, so I joined MBBS knowing that I wanted to be a dermatologist.
Okay.
I think both my sister and I had our own struggles with our skin and hair, and I had PCOS. I still have PCOS. I've had everything. I've had acne, post-acne marks, scarring, hair loss from a very early age, and honestly, when we were growing up, aesthetic dermatology was something that was still, just about entering India. There weren't a lot of doctors. I grew up in Vizag. There weren't a lot of doctors practicing aesthetic dermatology. It was more of core and clinical dermatology. And there was no social media, so there was absolutely no guidance. So I did my fair bit of putting, all these home remedies and oatmeal and bleach on my face for my acne. Damaged my barrier a little bit there. I absolutely used no sunscreen. So I think we both struggled a lot with our own skincare, and it took a huge toll on my self-esteem. And I think it was when my sister moved to Chennai. I think I was in like 10th standard. That was when she saw her first dermatologist, and there was Dr. Maya Vedamurthy in Chennai. That's who we went to. And then I saw her huge clinic, and it was filled with patients, and I was almost in like awe. And I wanted to be her. I was so inspired, and I knew I was gonna get into medicine and all of that. And yeah, so it was an obvious choice for me.
Okay, so that obviously helps you relate with a lot of patients that come in today, right? So what is that one, story that actually made you relate to it like more? Let's say a patient comes in and he's had a similar experience like you. Did you put yourself in the same shoes as him?
Yeah, I think just yesterday, I think I posted on my Instagram about this patient who honestly came in with her father. They've been to multiple dermatologists before they came to me. She had grade 4 acne. Like there wasn't a centimeter of her skin that wasn't covered with acne, and this was high grade. This was leaving marks and scars, and she was just fed up, and she was so skeptical when she came to me, and she was like, okay, I'm sure this is another dermatologist visit, and she's going to give me some creams and nothing's going to change. She had absolutely no belief in me or dermatology or that she's going to get better. So she got her father along, and then they were telling me like how distressing it was, and I could like see myself there. And then of course I evaluated her, and then she had like some hormonal abnormalities which we had to sort of look into and treat, and then I put her on some oral medication, and then it does take time, it just doesn't go away like that. There were certain lifestyle changes that she had to make, and then now I think it's been 5 months since I've seen her. Her acne is completely gone. The marks have completely lightened. Now we're just working on her scars, and I think in 2 months she's going to look great. And I can see the difference that's made in her life. She's much more confident. She's smiling a lot more. Yeah, I think as a
Amazing.
person, she's changed. Yeah.
Amazing. So, what are the most common struggles people come with? What are the skin issues that they mostly come with?
The two most common things are, of course, acne and pigmentation. The
Pigmentation.
third thing would be hair loss. Yeah.
Okay,
Yeah.
so it is, you can basically, divide them into three things,
Yeah.
not
I
just
think
only
these three
skin.
would be the most common that I see.
Okay, that's interesting. So, one thing that I see mostly people being very confused with
Yeah.
is with acne is
Yeah.
that they do not understand the difference between purging,
Right.
breakout,
Yeah.
and a reaction.
Right.
How can you explain someone as a beginner? Let's say someone's a beginner.
Yeah.
How would you tell him that so and so thing is a purging out of an active or a breakout or let's say a reaction from a
Right.
product that they've been using?
Right. So, see, breakout is just another word for acne. Pimples, breakouts, these are all just another word for acne. So, breakouts just acne. Purging is something that happens to someone that is acne prone.
Okay.
So what happens is whenever you incorporate an active in your routine, this could be an acid or a retinol,
Okay.
or if you do a procedure, a laser or a peel, all of these things tend to fasten your cellular differentiation.
Okay.
So what happens is they help you push out everything inside your pore. So all the acne that would have probably shown up in the following days or weeks, all of it just comes out at once when you
Okay.
incorporate an active or you do a procedure. Usually this happens post procedures also a lot. So this is purging. Purging per se is not a terrible thing. Of course, we're very cautious with doing certain treatments and incorporating acids in people who have very inflammatory acne, because even a purge can lead to pigmentation and scarring sometimes.
Right.
So purging is not really bad. It's just all your acne coming out at once,
Right.
and then you just have to get to the other side. Like
Okay.
after a purge, skin usually clears up. So with people with grade 1, grade 2 acne, we just tell them that you don't really need to do much if you're purging. Just let it come out. Continue using your actives. There's no need to stop anything. Just wait until you get to the other side.
Right.
But with people who have inflammatory acne, of course, we're a little cautious. And then if they're purging a lot, we probably put them on certain medications. There are antihistaminics that you can take, which makes acne a little less inflammatory. But again, purging doesn't happen in everyone. There is a certain subset of people who have extreme active acne.
Okay.
Only they tend to purge. Not everybody that starts an acid or Accutane purges. So that's a purge. Now the third thing, reaction. See, now acne or a purge, right? It's still coming out of the oil gland.
Right.
Like the lesion is still coming out of the oil gland, so it's follicular. So if you look up close, you see that it's coming from the hair follicle, from your pore.
Okay.
Reaction doesn't always have to be follicular. So
Okay.
it doesn't always have to involve the follicle. You can get it in the skin in between the follicles as well. So that's one thing that we look at. And reaction always, it could be itchy, there could be some burning sensation. There's always a clear history. They tell you I've applied something, I've used a new product, and this happened. So the irritation that comes with the reaction also tells us that it's a reaction. Also, difference between purging and reaction is usually purging only happens in the areas you would usually break out
Okay.
on. So say you're someone that breaks out a lot on your forehead, you would probably purge on your forehead a lot, right? But a reaction can happen anywhere
Okay.
on the sites where you usually don't break out as well. So that's
So,
another
what are
thing.
the most common ingredients you would say would like you will have a purging out of that? Let's say last year I had a purging
Yeah.
because I used salicylic acid,
Yeah.
something like that. Any other
Yeah.
ingredients you would like to give a heads on to?
So any active can make you purge.
Okay.
All acids, whether it's an AHA or a BHA, retinoids, any active, any ingredient that goes inside your skin and exfoliates your skin, basically peels off the top layer of your skin, can make you purge.
Okay.
It is not, but having said that, if you get started on actives, it's not that you have to purge. I hear this a lot sometimes. The minute I tell my patients that I'm putting them on a retinol, they'll be like, "Oh my god, but I don't want my acne to worsen." Now, this is not something you can predict and avoid. You
Right.
just can't. And it's not that everybody that starts using an active has to purge. It just
Okay.
happens to some people. It happens in people who are very, very
Sensitive
actively
skin.
acne prone.
Okay, acne
No,
prone
it
and
has nothing to do
sensitive.
with sensitivity again.
Okay.
Yeah.
So does your skin become very sensitive after purging, or does it like relax on its own? How long does it usually take for purging to go
Purging
down?
honestly doesn't come with sensitivity or anything like that. Purging
Okay.
just means breaking out a lot all at
Right, right,
once,
right.
right after starting an active or doing a procedure. That's it. It doesn't have to come with sensitivity or dryness or anything like that. But if you overuse your actives just
Yeah.
because you're breaking out a lot, that can sensitize you.
Let's say a person has purging for like 2 months or 3 months. When does he have to come check with the doctor?
So you brought up a really nice point. Again, going back to how do we differentiate if it's a purge or a reaction? A purge usually happens probably 2 to 3 weeks after starting an active,
An active.
probably, and
Okay.
it's probably in 2 to 3 days or 4 to 5 days after doing a procedure. You just get like a couple of pimples. That's how a purge usually works. But again, going back to how a reaction works, reaction is always immediate
Okay.
and it comes with redness, burning sensation, and sensitivity. Those are all signs of reaction,
Okay.
not a purge. Also, again, purging doesn't usually last as long.
Okay.
It will probably last for a month, and that's about it. So if it's going beyond a month and it's, over 2 3 months, then there's probably that's probably just your acne worsening. That's it.
Okay.
Yeah. Then you definitely going to have to get it checked out.
That brings me to the next
Yeah.
question. That is, I see the difference with my adult acne. I'm in my
Right.
early 20s now.
Right.
It is so much different from what I
Yes.
have seen with my
Yeah.
teenage
Yes.
acne.
Yeah.
Is adult acne a condition,
Yes.
or like, do we have to be worried about it? Like, adult acne needs a different skincare to be taken care
Yeah.
of
Yeah.
completely?
So yes, adult onset acne is characterized differently from, that peripubertal acne because it behaves very differently.
Right.
So see, now you know that acne is a disorder of the oil gland, right? So oil glands exist in our skin from the time we're babies, but they only
Okay.
become functionally active when you hit puberty. So when you hit puberty, you start producing sexual hormones, your estrogen, progesterone, and testosterone. It takes these hormones to go and functionally activate the gland. So functional activation means the cells in the gland mature and start producing sebum, which is why you don't see toddlers and children with
Right.
oil gland activity. They don't produce any sebum, right? Um, so until you turn about 25, these hormones are physiologically produced a little irregularly because all your sexual organs, everything is still maturing. Your body is still maturing. So
Right.
till 25, we call acne vulgaris. That's about it. And
Okay.
sometimes it can be physiological, right? So that's about normal acne. So after the age of 25, if you're still breaking out, then I'm sure there's usually a systemic cause to that. And this cause can be as trivial as not working out, not eating right, not sleeping on time, chronic stress, to something as serious as a PCOS or hyperprolactinemia or thyroid
Hormonal
disorders. So
imbalance,
there's
right.
always a systemic cause, and the acne is always extremely inflammatory. Inflammatory means it's red, it's big, it's painful, it takes about 10 days to heal, and when it's healing, it heals with a post acne complication like a mark or a scar. That's
Right.
the nature of adult onset acne. Yeah.
Exactly. Now that brings me to scars.
Yeah.
Acne, when it's actually on there for like years together, it
Yeah.
just doesn't go away.
Yeah.
It obviously leaves a very stubborn mark.
Yeah.
An acne that lasts 2 days
Yeah.
or an acne that lasts 2 weeks,
Right.
that will leave such a bad post acne scarring.
Yeah.
Now that brings people who cover it up
Yeah.
with makeup,
Right.
right, or tints, skin
Yeah.
tints. Does it actually worsen because they've applied makeup on it, or usually it's the nature of the scar that
So
worsens on its
that's the
own?
thing. So to correct you a little bit there, so whether an acne is going to leave a mark or no depends upon how inflammatory the acne is. So grade 1 acne, which is just comedones, your open pores
Okay,
and closed comedones and open
comedones.
comedones, those are non-inflammatory. So
Okay,
technically, they don't leave a mark, they can't leave a scar, right? Because there's no inflammation.
right,
From grade 2 onwards, acne becomes inflammatory. So grade 2 is slightly inflammatory, grade 3 is more, and grade 4 is obviously cystic acne with abscesses, again, with a lot of inflammation, right? So more the inflammation, more the propensity for you to pigment or to scar.
Okay.
right? Again, so you can put it like, if there's 50% inflammation, it'll probably just leave a mark. But if the inflammation is more than that, it'll
Right.
probably even scar you.
Right.
Some amount of your tissue just gets damaged,
Right.
right? And coming to makeup, I've not seen makeup worsening anybody's acne so far.
Okay.
What really worsens acne is if you wear makeup for really long hours. If you choose bad makeup, of course,
Okay.
if it's really occlusive, and if you're using like layers and layers of
So
makeup,
it
that could
is to
clog your
do
pores.
something. It is to do something with like applying the makeup or removing it.
So it has a lot to do with you choosing the
The
wrong
right.
kind of products for your
Okay.
skin
Right.
type. That's number one. And number two is you not taking it off. So if you
Right.
go to bed with makeup, that causes a lot of damage. But if you just wear makeup and you wear like a product that suits you. If you have oily skin, then pick up lighter, matter formulations. If you have dry skin, then you can go and pick up hydrating formulations. If you're wearing the right product, if you just have it on for about 6 to 8 hours a day, it's honestly not that big of a deal. It's fine.
Right.
That's not going to go clog your pore. If you
Okay.
don't take it off in the night, that's where the damage happens. Yeah.
Amazing. So, do you suggest for scarring,
Yeah.
in-house skincare is enough, or do you like suggest in-clinic treatments for scarring?
So, see, a lot of people confuse scars with acne marks.
Okay.
So, scars are pits, they're
Right.
depressions
The
in the
dips.
skin, right? So, in medical terms, we call it atrophic scarring, where there's where there a chunk of your skin is literally gone. So, for that, no creams work. Not for an early scar, not for an old scar. Skincare does not help with scarring whatsoever. Skincare
Okay.
helps a lot with marks, which is post-inflammatory hyperpigmentation in medical terms.
Okay.
Skincare helps a lot with that, but if there's a pit, if there's a depression in the skin, nothing helps. Then that is truly a procedural indication.
Okay, so we have generally spoken about acne now.
Yeah.
How would you like, we've already talked about 20s and 30s and how people deal with acne
Yeah.
in different this thing.
Yeah.
If you had to give one skincare advice to
Right.
people with acne, whether
Right.
that's from teenage, 20s,
Right.
30s, or beyond,
Right.
what would that be?
So irrespective of the age, if you have acne, first try to understand why you have acne. So if it's under the age of for people under the age of 25, it's usually it could be bacterial
Okay.
in some cases, where a course of antibiotics usually solves the issue. uh, Other times it's just like lifestyle, right? Because your body's still growing and things like that. Of course, like, fix your lifestyle, try to eat right as much as you can. Movement is again a very important thing. Try to get at least 3 hours of workout in a week, which is 30 minutes a day.
Right.
And like, sleep on time. These things usually matter the most if you're under the age of 25. Of course, if there's check if you have PCOS, get your hormonal tests done if your acne is not responding to skincare. So the number one advice would be to try and understand the cause of your acne instead of just like buying creams and
Right.
go see a dermatologist. If you have non-inflammatory acne, then by all means, with the knowledge that you have, go and buy some products and use them, and if it's helping, great. But if you are developing inflammatory acne and that's leaving marks, then you have to know what's causing it.
Okay.
Right? So know the cause is the number one advice
Right.
for everybody that has acne, irrespective of the age.
Okay, so non-inflammatory, as you told,
Yeah.
what sort of ingredients the patient has to see in the product if he has to buy it on himself?
So for non-inflammatory acne,
Non-inflammatory, yeah.
so salicylic acid is great. It's
Okay.
lipophilic, which means it can go inside a pore and sort of clear the pore out. So salicylic acid is a great ingredient. Benzoyl peroxide is also good. Benzoyl peroxide is an antibiotic,
Okay.
but it has both antimicrobial effect and it's also very anti-inflammatory. But it can be slightly irritating. So
Okay.
benzoyl peroxide, start with lower concentrations.
Right.
And the third thing would be a topical retinoid. Yeah. These
All
three.
right.
Yeah.
So if you had to choose only one
Yeah.
for, let's say, a beginner
Right.
or like a sensitive skin person, what would
Right.
that be?
So again, being a beginner is very different from having sensitive skin, right? Not all beginners have sensitive skin. So if you're a beginner and you have just like a normal skin type, I'm a big fan of topical retinoids. I think they're way more efficacious than salicylic acid or benzoyl peroxide
Right.
could ever be. So if you have if you have extremely oily skin, or if you have normal skin, or even if you have combination skin type, if there's no sensitivity whatsoever, definitely a topical retinoid. But if you have sensitive skin, then probably salicylic acid, because both BPO, benzoyl peroxide, and a retinoid could probably worsen the sensitivity. And all of these actives have to be paired with sun protection and lots of moisturization.
Right.
Yeah.
Okay, so let's continue with a little spicier segment, which is the rapid fire. You will
Okay.
have to be very quick and short answers, okay?
Right. Yeah.
First one, Accutane. Is it a miracle or overprescribed drug?
It is a miracle prescription only drug.
Okay. Prescription retinoids versus Bakuchi oil, which is the natural alternative. Which one would you choose? Retinoid?
Prescription retinoids for sure.
Okay. One skincare ingredient that the internet absolutely worships, but you think it is overhyped.
Niacinamide.
Okay. Unpopular opinion about acne that patients hear hating the most.
That you need to work on your lifestyle.
Okay. Slugging with Vaseline over active acne. Genius or disaster?
I'm not a fan at all. Nobody should do it.
Okay. Period skincare. Have you heard of it? Like switching your skincare with your
Yes.
cycle.
Yes, I have. Yes.
So do you
I do quite like it. Yes, I
science or
do.
scam?
It is science.
All right. Okay, let's slightly come back again to acne, but in a different form. Body acne.
Right.
Most of the people ignore body acne.
Right.
What is your take on it? Like, is it something to be worried about?
So, body acne, again, if it's inflammatory, it could completely leave a lot of marks and scar your back. So, yeah, I mean, you should take as much care of your body as you are with your face, for sure.
So, are there like causes, like how we see facial acne? Let's say a specific region has the specific reason for it on the
Right.
facial acne.
Right.
Does it have the same thing to do with the body acne as well?
Yeah, with body acne, honestly, most times there's fungal acne that happens on the back, which is not, again, very common with face. So people that work out a lot, people who have extremely oily skin, they tend to sweat a lot. There's a lot of build up on the back, so they could end up getting fungal acne, which is slightly itchy. The morphology is slightly different. It's more red, and the papules are smaller. It's sort of monomorphic. So fungal acne, of course, needs to be treated with antifungals. And one advice I give these people is immediately after your workout, shower.
Right.
Use an anti-dandruff shampoo. Use that to wash your body as well. And if you're somebody that sweats a lot, use antiperspirants, wear cotton clothing, don't wear extremely occlusive clothing. So these things help. So fungal acne is one thing we see a lot on the back, and hormonal acne can present on the back as well.
Oh,
And
okay.
these people, so you know that we do cumulative dosing with isotretinoin, right?
Right.
So people with back acne usually have very poor prognosis. So even if they finish their cumulative isotretinoin course, they could get a relapse. They could break out again later in their life
Right.
with weight gain and things like that. So that's another thing. Yeah, I think that's pretty much how it's different from acne on the face.
Body acne also be like, the facial acne, how it changes from age group onwards. Like, most of the teenagers don't really see body
Yes.
acne as much as adults.
Yes.
Does it have to do with age as well?
No, teenagers also see a lot of body acne. That's what I'm telling you. These are the kids that sweat a lot, probably don't shower enough. That can break you out on the back a little bit. And adult onset acne can present on the back as well, for sure. Yeah.
Okay, so what are the sort of ingredients you could suggest the back acne people?
Again, you can incorporate body washes with benzoyl peroxide, salicylic acid in them. If it's fungal acne, an antifungal needs to be in your body wash. An easy thing to do is to use an anti-dandruff shampoo both for your hair and for your
Okay.
body.
Uh-huh.
Yeah, sometimes if it's really bad, what I usually do is I ask them to apply an antifungal shampoo on their back and then probably leave it on for about like 10 minutes and then wash it off, and do this every single time they shower, especially post workout.
Right.
So that really helps. So yeah, benzoyl peroxide, salicylic acid, and an antifungal, these three for sure.
Okay. Usually that we see today, most of the products have, let's say, salicylic acid and lactic acid. Lactic acid is for tan only, right?
Right.
Not for acne.
Not the preferred acid. So any acid helps with acne because
Okay.
any exfoliant would ideally help with acne, but it's too mild. Again, it's not lipophilic like a salicylic acid is, so definitely not the most preferred acid. I like salicylic, mandelic better for acne.
So let's say we have to simplify skincare for
Yeah.
someone who's a beginner.
Right.
What are the 3 products which are
Right.
non-negotiable for someone who's just starting out with their
Yeah.
skincare?
Right. Definitely a cleanser, a moisturizer, and a sunscreen.
Okay.
And if they want to sort of exfoliate, then they can do that as well. So I always tell this to my patients: a good skincare routine should have equal parts of sun protection, exfoliation, and hydration.
All right.
So if you just sun protect and hydrate and you're not exfoliating at all, it could make you a little dull because there is that dead skin built up. If you're exfoliating and only using an SPF and not hydrating at all, that could dry you out. If
Right.
you're using a moisturizer and an acid but there's no sun protection, that could sensitize you. Which is why
Right.
there has to be these 3 parts in equal amounts for you to sort of
Right.
yeah.
Okay. Right. Let's just put a pause to the acne now. There's a lot of advice,
Right.
skincare advice,
Right.
acne, pigmentation, everything.
Yeah.
How would we, determine a person is qualified enough
Right.
to give so and so advice,
Yeah.
whether that's influencer or a
Yeah.
dermatologist?
Yeah.
How would you give that?
See, of course, you need to start by knowing the credentials of a dermatologist, and you must obviously seek advice only from a qualified dermatologist. So the credentials are pretty much MBBS and MD,
Okay.
DVL, and MD in dermatology. It can be a DNB or a diploma in dermatology as well. So always check the credentials, and most of the times, see, when there's an advice out there on internet, you need to sort of think if it's just anecdotal, if it's something that's just happened to them, if it's something that hasn't worked just for them, or if the ingredient itself is bad or great. So I
Right.
think with influencers it's a little bit anecdotal. They sort of tell their experience with it,
Right. Right.
and you could have a completely different experience with that ingredient. So yes, always seek advice from a dermatologist.
Right, right. Perfect. So this brings us to the end, Dr.
Right.
Showrya. Thank you so much. This
Yeah.
was an incredible, very insightful conversation with you. Thank you for joining us today.
Yeah, it was so much fun to do this, and I loved all your questions. And I've been on podcasts before, and I honestly felt like in most of the podcasts, the questions were very repetitive, and all the information was already out there. I felt like we sort of went a little deeper with this
Yeah.
podcast, and I hope people love it.
Thank you so much. All right, I'm sure all of you must have taken some sort of clarity from this conversation. And again, thank you so much for joining us today.